Hello, everyone, and welcome to the World Health Network broadcast. My name is Ben Calderwood. We're excited to share another special episode today with you, of sorts, a roundtable featuring some familiar faces discussing the recent US election and what these results could mean for the future of public health. And we're going to try to address this today at the policy level and at the personal level as well. We've also asked WHN members about their public health questions and concerns moving into 2025. We're going to be posing a few of these questions, these audience-submitted questions, to our panel today. So joining us are Dr. Yaneer Bar-Yam, complexity scientist and one of the founders of the World Health Network. Thank you, Yaneer.
Thank you.
Also, we have Dr. Eric Feigl-Ding, frequent contributor to the broadcast, an epidemiologist and health economist. Thanks for being here, Eric.
Thank you for having me.
And Dr. Sam Bernard, who focuses on behavioral and psychological health and crisis response.
I'm honored to be with you all.
Thank you, Sam. All right, well, let's get into it. Our first topic, and I'd like to start with Yaneer for this question. In broad strokes, in public health terms, Yaneer, what do you feel is the most important takeaway from this recent election?
So I want to step back from political questions of parties and, election specifics. But really the key takeaway is in the systemic failure of institutions, not in which individuals are holding office. The institutions that are around us, including public health and governance, are failing to perform their roles effectively. These failures are persisting regardless of changes in leadership, showing that this is a systemic problem rather than one tied to specific individuals or parties. And this is evident in the inadequate guidance that we've had from the CDC, which we've been confronting in direct ways during the COVID pandemic, as well as the insufficient response to the emerging H5N1 threat. And these challenges are obviously widespread in the public health arena, but they're also really extending to the whole framework of governance in our society. The election is reflecting, it is intensifying these institutional failures. And part of this is manifest in the deliberate intention to dismantle the functioning of critical public health systems and governance. Now, this intentional process is making it more and more difficult for society's ability to address both individual needs and respond effectively to crises. And to address this, we really need to think more clearly about how we can address institutional failures and recognize that these institutions are not capable of addressing the challenges that we're facing today. And there's really an urgent need to build or rebuild institutions that can meet these challenges. So there are two different things that I want to point to as really the important takeaways. One is there is still, of course, need to influence and reform existing institutions and to act in order to make the best we can of what is going on. But we also have to act immediately to support individuals and communities in addressing the urgent needs that are present over the upcoming years. And this may include creating mutual aid networks and alternative systems that can improve the conditions as we work on building more effective institutions over time. So again, the lesson to be learned from the election is the need to rethink and rebuild institutions to ensure they are capable of addressing our challenges and meeting the needs of both individuals and communities. And I think at that, I will turn it back to you for the next questions.
Well, let's jump to our first user-submitted, WHN member-submitted question on this topic when we're sort of focused on possible public health fallout from this recent US election, I'd like to turn to a question we received from L. Thank you, L. Uh, are there other countries or authorities that we should consider looking to for public health guidance on diseases like COVID-19, on diseases like H5N1 bird flu? And this is something, Yaneer, Eric, and Sam, that you can all weigh in on our WHN audience submitted questions.
I think that it is important to see that the institutional failure is very widespread globally. And this includes, at this time, even in the countries who were effective at meeting the challenges early in the pandemic. Of all of the countries, my impression is that the one that has resisted the urge to push towards normalcy the best is actually India. India had very good guidance early in the pandemic, and they, at this time, continue to recommend significant actions in travel and other conditions. That doesn't mean that the recommendations that they're making now are adequate. And for example, if someone is ill on a flight, they're isolating them and so on. But this is not enough to meet the current challenges. But it is still much better than any other country that I know of in terms of policies, where most countries are largely ignoring or completely eliminated their precautionary measures at a time when COVID and other diseases are becoming, and are becoming, major challenges.
Well, I agree that many other countries have done pretty well. Also, Australia, New Zealand. But I think the other factor we have to face reality is public health, unlike other sciences, is a science of policy, and policy is inherently intricately tied with politics. So, for as much as we try to avoid the politicization of public health, which in an optimal world, I think we should avoid politics when it comes to public health and just try to save lives. That's not the world we live in, flawed institutions or not, because there will always be political influences on policy. And I think we can't ignore the elephant in the room that, in the US election, with Trump winning and RFK Jr. potentially becoming HHS, Health and Human Services Secretary, and all the cadre of anti-vax people he's hiring, as well as pro-mass infection staffers and other appointees, and many other, like the CDC director is also anti-vax, the incoming CDC director. All of these inherently mean that we're at literally the whim of some of these anti-vax madmen. And I think it's not a political criticism, but that they have this inherent, refusal to recognize the science. Refusal. You can fix institutions all you want, but if you have the leader of Health Institute, health cabinet agency refusing to recognize science, that's going to be a problem. And by the way, it's not just anti-vax. He's also pro raw milk, which in the era of H5N1 is also very dangerous, with California just declaring emergency and CDC confirming the first hospitalized avian flu case in Louisiana. This lack of recognition of science and the pushing of unproven medical claims and unsafe public health practices is gonna be the theme for the next 4 years. And this is inherently the world we live in. We voted for Trump, the Electoral College, the voters have spoken on that, and this is inherently what we have to live with. So I feel like we can try to reform institutions as much as we can, but right now the institutions are going to be led by anti-science people, and we have to fight back and almost like we have to create shadow cabinets that UK has. We have to rely on NGOs pushing the correct scientific message a lot more. And we can't rely necessarily on say, the medical associations, because medical associations right now are also very complicit, wanting to seek favors with, Centers for Medicare and Medicaid, which sets doctor reimbursement rates. And if you upset the agencies and criticize their leaders, then they will not be very favorable to your medical association in setting certain reimbursement rates. So many other, health organizations are, conflicted and compromised in that way. So we have to build from the ground up outside of government if our government leaders are not going to recognize science.
Yaneer, did you want to chime in on that
I
topic?
want to chime in a little bit more because I can say I agree with much of what you said, but there's one thing I would point to, which is that, yes, the systems that we have bring public health into a political context, but it is not always necessary. We do not expect the fighting of fires to be politicized. And the question is, why isn't public health framed and institutionalized in a way that is similar to the societal engagement in firefighting? This is something that presents an alternative model, and the extent to which we can think about creating institutions that will meet that model rather than the current political model of public health, I think is part of what we should be thinking about and addressing.
If I can, Eric and Yaneer, what you're discussing now segues very naturally into what is our next topic. Obviously, Eric, you were voicing your concerns about the potential ramifications of what the individuals and the policies that they are proposing possibly mean for a Trump administration in 2025 and beyond. Could you explain a little bit to our audience, just very high level, about the structure of the agencies these individuals might be supervising, starting with HHS, Health and Human Services, and what they are responsible for, and a little bit about the nomination process, which is to say, what is the likelihood of these individuals actually successfully being confirmed and being in positions of power and potentially being able to have control in the manner that you and Yaneer were just discussing?
Yeah, this is a very good question. And I think this is where the power structure of the dynamics matter. Like, unless we change the Constitution, which is a very difficult process and a very politically fraught process, these are the institutions. And the institution is the HHS is one of the largest agencies. It is, and we're not just talking about, single billions. We're talking about hundreds of billions of dollars flowing to HHS. It oversees CDC. It oversees FDA, Food and Drug Administration. It oversees Centers for Medicare and Medicaid, which sets a lot of reimbursement rates for Medicare and Medicaid, and also what things are covered. It oversees vast, whether it's the ASPR, basically the pandemic preparedness emergency offices. It is by far one of the largest agencies in the US government, and the budget of it is one of the largest because it includes Medicare and Medicaid. And I think for the first time, the CDC director, it will also require Senate confirmation. In addition, previously CDC director was just appointed, but I think they changed the law that it will require confirmation this time. People can double check what I said. FDA commission also needs to be confirmed, and Center for Medicare, CMS, also needs to be confirmed in addition to RFK Jr. And RFK Jr. is the most controversial because he was obviously known as the anti-vax king, having led anti-vax nonprofit for many, many years, and that's his most well-known platform. But his platform is also, anti-fluoridation, which is obviously against most of public health to remove. And he's also pro raw milk, which is obviously not very safe. And every public health scientist kind of opposes it. Anti-seed oil, many other controversial views. But he has to get through basically Senate confirmation. Senate confirmation requires a 51% majority, But there are many people in Congress, even those Republican controlled, who actually oppose RFK. So it depends whether 4 senators will defect, because 3 can defect and the vice president can still cast a tiebreaker to confirm him. But if 4 or more defect, then he will be kind of like shot down. And his comments about about polio. So basically, his lawyer, his leading advisor, staffer, and lawyer for many years, has been petitioning to get rid of the polio vaccine and many other childhood vaccinations. And this person is, helping RFK hire and staff up the HHS. So there's many people who basically oppose RFK Jr. because, his entire philosophy is anti-vax. And so Mitch McConnell, the former Senate Majority Leader, Republican, is very much against that. So hopefully, maybe there will be a way in which this anti-vax person, RFK Jr., won't be confirmed. But these gets into the politics. And by the way, it's the Senate Finance Committee that decides this. Interestingly enough, not the Senate Health Committee that confirms and gets out of has a first level review. After it gets a vote out of the committee, the Senate Finance Committee, if it reaches a majority, then it goes to the floor of the Senate. So there's a debate. Maybe because a lot of senators don't want to oppose Trump because RFK Jr. is Trump's pick, that if they can stop it in the Senate committee, if he doesn't make it out of committee, then he won't even have to face a floor vote. So all these will be happening in the coming years in early 2025, and we'll see. Many Trump appointees may not get Senate confirmed, but regardless, we know that many other of his appointees have been very much anti-vax or pro-mass infection herd immunity, including also the NIH director, Jay Bhattacharya, who is inherently one of the architects of the Great Barrington Declaration for mass infection. So all these picks, very controversial, and we can try to put our heads in the sand and say that politics has nothing to do with it. But this is the world that we live in, and we are at the whims of these Republican senators and how whether they vote these candidates up or down or not.
We're going to get to a question a little bit later about what individuals can do to combat misinformation and disinformation along these lines. For the moment, while we're discussing possible appointees to these very important positions, I'd like to jump to another WHN member question, and this one was submitted by Kevin. What are your thoughts on the possibility of food safety regulations being killed? And is there anything that people can do, and specifically chronically ill individuals can do, in light of that possibility to ensure their own well-being in the future with regards to food safety? And this is, of course, a question for our entire panel.
I'm happy to take a first cut at it. I think that one of the challenges is not just if there is change in those regulations, but in the question of how well are they being enforced. And the key issue is that a lot of the protections that are being expected are being less enforced, and this creates the question of whether that laxity will be then exploited in the context of market dynamics to reduce the safety that people are expecting. And we've seen this in multiple arenas, not just pandemic safety, but many other domains where public protections from pollution problems and other things are not necessarily being enforced. And right now, the question about food safety is something that we should be watching out for, but the question of the ability to be aware of water safety, food safety, all kinds of things, becomes a challenge, which is then needs to be met by very clear awareness of what's happening and perhaps technological opportunities to do testing and such new measures that would enable us to identify when food is safe and not safe. But all of these are coming in the context of the widespread challenge of how do people protect themselves in a context where the system is not recognizing the primary role of protecting the public.
And in terms of food safety, in the Trump administration, the food safety kind of falls in two domains. One, it's obviously Food and Drug Administration, but also on the agriculture side, the USDA has a separate oversight in food safety. There's an undersecretary for food safety in the agriculture, and whether it's the USDA inspectors, USDA helps sets the line speed for many of the meat processing plants. And if it's too fast, it's faster than people can safely process some of these slaughterhouse and meat
Sorry,
processors.
Eric, line speed, you're referring to the rate at which product through the
Yeah,
factory,
basically
right?
the rate at which these lines basically move through the meat processing
I see.
system. That's just a terminology for that. And the first Trump administration, first of all, didn't have a undersecretary of food agriculture for the longest time, and they loosened the line speed, basically allowed it to be faster, which endangers in terms of food safety and also inspections. They also cut staff for food inspectors, USDA food inspectors, which is already abysmally low, and they're expected to deregulate that even more. It's basically politics decides a lot of things, like how much an agency will, the Congress decides on how much money that agency has, but it's the executive branch and the nominees of these agencies who then decide how much money they're going to allocate to different things. Like, are they going to allocate more or less funding for USDA food safety inspectors? Are they going to put less regulation and less enforcement of food safety measures? And whether it's milk products, like there's a raw milk recall set by California, but no other states, right? And all these industry lobbyists will be trying to lobby, and some agencies are and administrations are less susceptible to lobbying by industry because they put public health first. Some administrations will be much more favorable to what industry wants and demands. And I think this is the reality, and this is also the things that you don't see beyond just the anti-vax views of one nominee or not, because it's the whole political party ideology of deregulation and laissez-faire market economics, and not regulating, imposing regulation on these food manufacturers and agriculture companies.
If I could,
I'm sorry, Sam, go ahead.
Looking at the issues that have just been raised from a policy perspective to a personal perspective, the United States has basically come into existence from strangely enough, a bit of a resistance and revolt beginning. That's why the U.S. exists. Otherwise, we would be with the European nations. So, in a way, at the 50,000-foot view, we're being consistent. However, it's a bit uncomfortable now. And if I could take more of a a 50,000-foot view of what we're experiencing right now. If you look at the basics of human nature, we look to our parents to provide protection, to provide our basic needs. Food, clothing, shelter, water, safety, those sorts of things. And I think that most folks would agree that we've had, if not a just a dissolving of some of those concepts, at least a loosening of some of those concepts, especially in some socioeconomic groups. And then as we tend to progress, some of those concepts we've actually projected onto government. We have looked to government to provide on a much larger scale, on a societal scale, protections for food, clothing, shelter, safety, that sort of thing, on a national level, on a societal level. And I dare say that just as in our parents or primary caregivers, before they were parents, they were human. Um, and the irony is, and they are afterward. Um, and because we're human, we're not perfect, and humans fail. We're not equipped. We're not manufactured to be perfect all the time. So there's going to be some errors. There's going to be some shortcomings. Um, and when those shortcomings are seen as significant, whether as in a child's eyes or in a nation's eyes, those shortcomings can lead to mistrust, both at the parental level and at the government level. So I see what's going on right now as somewhat of an extension of our humanness. However, many times parents, when a perceived transgression has occurred, parents explain, why they did what they did. They take responsibility for actions or inactions, and it's processed, thus regaining trust in that parent or that caregiver. Um, and I think that government is experiencing some of those same sorts of growing pains. They're falling short of the expectations of the citizens in which they've been elected to lead, guide, and direct, and I would dare say even protect. And that's one of the big issues that has led us to where we are today. And now, 2024, a majority of the country has felt like that the parents, the government, has fallen short. They have lost trust. So, and therefore, they've chosen a different leader, a different, if you will, parental figure. The problem comes is that in the beginning of America, the United States of America, the elected leaders were looked to as, and I don't mean this in a sexist way, statesmen or statespeople. And in other words, their overarching goal was to do what's best for the country. Unfortunately, there has been a kind of a refocus of that with some leaders to do not necessarily what's best for the country, but for a political party. So it's a narrowing of the focus. And then some have even gone so far as to focus not on the benefits of a party, but for individuals, such as giving contracts to coworkers, to friends, families, those sorts of things. So again, it's the intentionality, if you will, the integrity of the elected leaders, but also that ties into a concept that I'd already mentioned, that is trust. When a leader, whether it's a parent or a legislative leader, violates trust, that can definitely shake the foundations of either the children or the folks who have elected them. So it then comes around to, so what does the figurehead do to either reestablish trust, or do they maintain the course and leave that violation there to, if you will, fester and to actually be pathological? So all of that to say that uh, we need to look at how do we establish trust, uh, and even for kind of regaining some civility, how do we gain trust of people when they may not understand why we need to do things the way we do through science? Um, but also, how do we, once we gain trust, how do we maintain it? And how do we go about continuing to maintain that through turbulent times? And I think that pretty consistently, some family units and also some legislative units have actually failed in maintaining both the individual and the public trust.
Let's stay on that topic for a moment. When we talk about failing to maintain the public trust, when we talk about individuals who look at the actions of an incoming Trump administration and regard these choices that we have been discussing thus far, challenges to public health, what I think some people regard as institutional abandonment, the parents, quote unquote, failing to do their job, failing to take responsibility for their children, to use that terminology, we realize that for many individuals, those experiences can be incredibly stressful, especially for individuals who are in marginalized groups, especially for individuals who may be facing chronic health challenges. Looking forward, how do we help those individuals cope with these circumstances that we find ourselves in moving into 2025 in a second Trump administration?
I think looking at this question kind of from the psychological point of view is that, like children who are existing in less than favorable parental households, many times those children look outside the parental household for leadership, guidance, and directions. So they may look to um, grandparents, they may look to aunts and uncles, they may look to cousins. There's a tremendous amount of evidence and research that supports that sometimes people will look to gangs for leadership, guidance, directions, and a sense of safety because of affiliation. We also know from a long history in the world that people will affiliate for spiritual beliefs. So religious communities, religious groups can help provide that sense of community, that sense of safety, that sense of belonging. So getting back to when parents or parental-like figures, legislators, fail in the eyes of those that they are entrusted to care for, there can be some overarching morals or even mores that are accepted, either written or unwritten, kind of rules of behavior or rules of engagement, if you will. And when those either written or unwritten morals are violated, they can come in two basic kind of categories. One is accidents of, well, okay, this kind of went sideways, and there is no intentionality of things to go sideways. So, and the example would be like natural disasters, such as tornadoes, hurricanes, cyclones, earthquakes. Those are seen as natural disasters, as opposed to terrorist events, where those kinds of events are intentional and the origins of those types of disasters are human based as opposed to natural or earth based kinds of situations. So when human values or morals are violated, that cuts much deeper than if an accident happens without intentionality. So the moral injury that I dare say a majority of the United States is experiencing from the folks who elected Trump, they are experiencing what they would say would be a moral injury that the folks in leadership have violated their moral trust. And just as the folks that are opposed to Trump, they are experiencing moral injury because he is doing something that is totally anti their their knowledge or their awareness of morals and values. So, in essence, everyone is experiencing a bit of a moral injury. So the problem comes in the intentionality. And I think we can say that on both political parties that there has been intentionality for their actions or inactions for many years. That it has been for sometimes individual or specific group gain, such as Democratic or Republican, and not necessarily for the country or the society, or even, if you will, the world, the earth. So that violation of worldviews or the violation of morals may be at the heart of what's fueling the fires right now.
We've spoken a lot, thank you, Sam, about trying to clearly articulate the challenges we feel we are facing as we move through the inauguration into 2025. For our last question, we really want to kind of switch to a bit of a different lens and look forward for a moment. And so this is a question for everyone, for Eric, Sam, and Yaneer. At the individual level and at the community level, let's take a step away from the Senate and confirmations in government for a moment. Considering all of the challenges that we are facing at the individual and community level, really, what are steps that we can take to feel empowered, to feel more comfortable, for individuals to care for themselves and to care for their communities moving forward?
Yeah, this is a very good question, and I get asked this a lot, actually. What can we do outside of whatever the federal government Trump world is doing? And I think in many ways we have to prepare our family and our community for what's to come, because if they, say, remove vaccine mandates for children attending schools, and vaccine um, compliance rates have already been dropping precipitously over the last few years, and many communities have already dropped below herd immunity threshold. So there's now more outbreaks. For example, whooping cough, which is covered by the pertussis is covered by the Tdap and DTaP vaccines, is 6 times higher in 2024 alone compared to 2023. And basically, we have to take these community measures to steel ourselves. Local leaders really, really matter, and advocating to them to protect your family is something I think that we should focus on, because I think in many ways we can't change the federal government, but we can change the advocacy on our local and state level. And for school boards, if federal guidelines remove the vaccine requirements, which, oh, by the way, is oftentimes required by state level government agencies, not the federal, we can still advocate to keep our community safe. I think focusing on keeping your own community safe by being more active on local school boards and active with your township, your city, and your state will pay huge dividends against whatever chaos happens on the federal level. Because, and also I think, having the grassroots activism, if, be the change you want to see in this world, advocate, let your voice be heard, and advocate for safe public health policies, even if there are those who oppose in the government, but advocate on your behalf because science is behind all these public health policies and measures. And team up with, because most scientists are not natural advocates, but they know what they're talking about and they know the science. And I think in terms of grassroots advocates and scientists should team up to push forward for community health and community safety.
A sort of an alliance between scientists and advocates, which I suppose one could argue is precisely what the WHN is in many respects, now that we're
That's
talking about
correct.
it. Yaneer, can I ask, you mentioned early on in our conversation mutual aid networks. Could we talk a little bit more about the value of mutual aid and sort of the structure of mutual aid networks in local communities?
Sure. So, I have the reason why I got into community efforts was because the science actually tells us when we analyze these challenges that the source of the solution for the problem has to be the community.
Hmm.
And the community and its relationship with its individuals is super important because individuals can find ways to protect themselves, but it is much more difficult because most of these things have to do with interactions in the community. Diseases are not an individual phenomena. Diseases are transmittable diseases have to do with the community. So we have to find ways of engaging in community efforts. When we look at the community level, the problems that individuals and communities are facing are not one-dimensional. They're not restricted to public health problems. There are economic problems, there are education problems, there are many other problems. And those problems have to be addressed together, otherwise they cannot be solved. So mutual aid systems have to be recognized as the cornerstone of individual and community health and understood in the broad sense of what is needed. And these are the systems that we need to develop in the context of failure of institutions. And Eric mentioned that there are local institutions, there's local governance, and so on. And all of these are important, but mutual aid systems and other such systems that empower people within the community must be the building block for our ability to move forward. And the last thing that I would say is that individual feeling of disempowerment, the people feeling that they cannot do things, is the most damaging situation for people in this context. We really want people to understand that there are many things that individuals can do, and moreover, that individuals with others can do to improve their and others' situations. And recognizing that this is possible doesn't make it easy, but it enables people to investigate the things that they can do and to take responsibility away from, as Eric was putting it, supposedly protective members, as Sam said, the people who we usually rely on. Under these circumstances, people have to take back those responsibilities and to create new systems of protection.
I would actually take that one step further, and that is to encourage, just like led to the existence of the United States of America, to encourage creativity, to encourage ingenuity, to encourage new levels of thinking, consideration. However, to do that with the backdrop of civility, not necessarily throwing caution and wisdom and morality to the wind, but to maintain a sense of dignity and civility as we move together into our future. I think it's going to be important for us to be able to come together, as Yaneer was saying, at the community level with a mutual aid kind of mindset, very similar to what has happened with FEMA. And yes, there is a federal government response to disasters. However, they have also developed CERT teams. And CERT teams are community emergency response teams that are specifically designed to help out in an emergency in a specific community until the federal government can come together to get mobilized to respond to that area. So it is empowering local people in local communities to basically help themselves until more aid can get there. And I think that that's a real healthy approach. I think that there's also a concept that is not going to be popular. This is not going to be popular with Yaneer and public health folks. However, folks in the healthcare industry, it's a very bitter pill to swallow, and that is the concept of casualties. And I mean this not in a European sense of casualties, but in the sense of there are going to be some losses because of the situation. That for any situation, there's going to be some losses, whether it's a tornado, whether it's a hurricane, whether it's a terrorist event. There are going to be some people who are injured because that event occurred. Some of those people are going to heal afterward. Some of those people are going to heal and they're going to be able to return to their pre-morbid level of functioning. Some people are going to maybe not heal as much as they could have or should have, and they're not going to be able to return to their pre-morbid level of functioning. Then there's also going to be some folks who are going to heal from that event, and they're going to be able to actually exist on, if you will, a higher level than they were previously. And we talk about that in terms of post-trauma growth. The other unsettling reality is that there are going to be casualties. People are not going to be able to make it through an event. There are going to be deaths because of this, whatever this is. Whether it's an administration, whether it's a hurricane, whether it's a tornado, an earthquake, a tsunami, there's going to be casualties,
But
as well as there's going to be post-trauma growth potentials as well. Our goal, while admirable, that everyone is saved, is a wonderful goal. And I think that we also need to keep in mind that there's a comma there, and realizing that there's going to be some folks who are not going to be able to make it through as well.
I think if I could say, the fact that we all recognize the reality of loss is super important. But as you've said, it doesn't negate the statement that the ability to recognize and to chart paths that are able to achieve the best that we are able remains the challenge, but also the recognition of loss enables us hopefully to support those who suffer from those losses and enables them to emerge from them in a constructive way. Eric, do you want to add?
Well, I think in certain ways we shouldn't give up just because, there will always be deaths. There's always, that's why we talk about excess deaths, right? Because we recognize there deaths will always continue. It's aging or many other causes in society that we can't solve, we don't have a cure for, we don't have preventions for. But I think preventing the excess deaths should be the goal, and that's why we calculate the impact of COVID on oftentimes excess deaths and excess unemployment and excess external things above these externalities. But I think we can fight for, say, we know that seatbelts will save lives. We should fight for mandating seatbelts. We know that drunk driving kills. We're not going to a country in which we abolish all alcohol and abolish all driving, but we can abolish drunk driving as much as we can, right? With various laws against drunk driving. And, I think there are steps we can do to go beyond, we're not being absolutist by banning alcohol and banning driving, but we can do to make people as healthy as possible. There's also optimum defaults where we try to automatically turn on airbags when people buy a car so that they will be safe even if they forget to turn on the airbag whenever they get into an accident, because accidents are going to happen. But I think this is where public health, we cannot just give up and sit back and have the come what may attitude of acceptance. We should try to minimize the casualties as much as we can and warn people as much as we can, recognizing that we're not able to save everyone, but we should try to save as many people as possible. And the good of the many, the value here is that right now there is going to be a tide of misinformation, disinformation, dangerous policies that are antithetical to public health that we must fight against in the coming years. And that's why I advocate for everyone to join the WHN and help us and stay in the fight.
Let me just emphasize this point that what I've seen, and this is not just now, but this is for many years, is that when there is death, even when there's injury in the medical context, many people think that this is inevitable. And there is an acceptance of this that undermines our ability to improve the systems and causes us to continue to suffer. When you trip over something and you don't recognize that it wasn't, if you think that it was inevitable, you won't fix it. But if you trip over something and realize that you can prevent it from happening in the future, then we learn and we continue to improve. And this is one of the things that has not happened during the pandemic. The we can do attitude that's characteristic of the United States has become a we can't. And this messaging of we have to live with the virus or we have to accept the conditions or all of this stuff is the thing that is the most damaging to our ability to protect ourselves and others and the society as a whole.
And with that,
the concept,
sorry, go ahead, Sam.
and I agree that the concept of excessive death or excessive risk is there, and I think that it behooves us to truly use all of the resources that we have as much as we possibly can to help prevent as many deaths as possible. At the same time, recognizing and respecting individual choices for whatever reason, whether it be for moral reasons, for spiritual, religious reasons. At least we can say that we have given access to as much information, as much support, as much intervention as possible. so that we can make those excessive deaths as minimal as possible, so that everyone can have as much of an informed consent as possible, then at least they're as much as possible informed casualties.
You think, I think this has been a really incredible conversation. I think at both a sort of macro level, the public health macro level, as well as the personal level. I think this notion, you know, that I think we've all been discussing to some extent, Yaneer and Sam in particular, this idea of trying to move through the sense that that this sense of futility that is largely manufactured, that in fact there are steps that we can take to do better at both the governmental level and on the individual level to care for ourselves and others. That's kind of a critical takeaway here, in my opinion, as we continue to have these discussions in the future in 2025. I will say, obviously, that you know, the public health implications of this election are a key focus for WHN. We are committed to having more conversations like this in the future. So I do hope you'll consider subscribing to the channel and staying tuned for those. Let me take this opportunity once again to thank today's guests, I'll say it right, Dr. Yaneer Bar-Yam, Dr. Eric Feigl-Ding, and Dr. Sam Bernard for talking to us today, for their insight and participation. And I want to thank everybody for watching. If you'd like to learn more about WHN and our work, please visit our website at whn.global. Thanks so much again. We'll see you on the next broadcast.
Thank you.
Thank you.
We're out. And Eric jumped. We're gone. All right, I'm going to stop recording.
He said that he had to leave.
Yeah, I know.
Yeah.
Fast.